After we have all this information about HIV, AIDS, and STIs in general, the next section has to be about prevention. Obviously, we hope you already know this for your own health, but we're going to reiterate on it and maybe expand what you know a little bit. In general, STD, HIV, AIDS prevention methods fall into two different realms. First, there is public quote-unquote prevention, because it's more figurative, and then there is literal prevention, which occurs in the private sphere. So public health strategies for prevention include targeting core transmitters for prevention and treatment services, changing social norms by encouraging people to have safer sexual behaviors, encouraging condom use, and making condoms available. The main elements of that public prevention strategy include but are not limited to education, counseling, making multiple contraception choices available, making knowledge about condoms and safe sex available, sterilizing procedures in hospitals and for blood transfusions, making testing available, positively reinforcing good behavior, and asking questions of the public, such as why is it important for two people to talk about HIV and AIDS, and why do people not talk about HIV and AIDS or STIs, just to encourage the population to think about these more sensitive topics. Private sphere strategies, which are what we're going to be encouraging, are obviously people getting tested, positive behaviors, reducing their risk, so being monogamous or using condoms and having sterile surgical tools, razors, and needles, and reducing their own risk through decision-making skills. There's a suggestion of the ABC method, which is abstinence, be faithful, and C, use condoms. Reducing risk with communication between partners, asking questions about sex and AIDS between the partners and being honest with answers, and also actively trying to avoid HIV and AIDS by having one partner and having persons with HIV and AIDS and people who are pregnant be treated by medical professionals to decrease the likelihood of that virus being passed on. There was a specific UNAID plan to prevent HIV and AIDS in Morocco. It was implemented in 2007 and through 2011, and the actions included developing a new national strategic plan for the response to AIDS, and it's currently implemented in 4 priority regions. Technical assistance for the preparation of harm reduction programs for the benefit of IDU and its implementation in Tangier and Tetuan. A survey and national workshop on migrant populations' vulnerability to HIV in preparation for the development of an integrated action plan in the field. The elaboration of specific programs for the reduction of women's vulnerability in rural areas. The launch of a training program on human rights and HIV/AIDS-based program development planning. Expansion of prevention programs targeting in-school and out-of-school youth. Review of epidemiological estimations and projections. Institutionalization of a unified monitoring and evaluation system, and the preparation of a national report to UNGASS. Other prevention plans used in Morocco include CETA clubs being required in all dar shababs, and talking about CETA occasionally in schools, but only in a purely scientific matter. Potential Moroccan factors prohibiting prevention of STIs include the social stigma, and a population pyramid, which means that the bulge of the population is between the ages of 10 and 25 years old. There's a high infant and maternal mortality rate here, also a lack of economic empowerment, and high rates of emigration and immigration. There are also a lot of important graphs pertaining to these different types of prevention and success in Morocco. The document which shows those graphs can be found on the screen right now. And it just shows a correlation between things like HIV testing and prevention of mother-to-child transmission and who the most at-risk populations are, what prevention programs are, etc. So we suggest you check it out.
Created using Powtoon.